Hello friends, in this video we will talk about physiology of vision. So we will see with introduction, physiological anatomy of eye, image formation, color vision, refractive errors, color blindness, pupil and light reflex along with the visual pathway and lesions. So as we know very well, eye is the key organ of sight. So if we have to see any object, like if we want to see the TV, the fridge or whatever it may be, right? So eye is going to help you do that. Analyze the object and know what it is. So there are two axes we have to understand, optical and visual axis. So visual axis you are seeing it is coming from the fovea centralis, also from the anterior and the posterior pole. Only posterior pole is the optical axis. Okay. So this is to show you a structure of the eye. What is inside the eye? Let us see. Lens, iris, okay, ciliary body, cornea, okay, and these are the muscles, maybe superior and inferior rectus could be, okay. And this is the visual axis which we are seeing. Fovea centralis, it is pointing out there. This is the hyaloid canal lodged in the hyaloid fossa. Optic disc, the blind spot where rods and cones are less, and this is the optic nerve and towards the brain, okay. And these are the main three layers: sclera, choroid and retina. Remember, choroid is having blood supply, okay. So remember it as South Central Railway, SCR. S as in sclera, C for choroid, R for retina. Okay, so let us see the layers which are present in the retina. This is a histology picture to show you. So we have the sclera, first layer, choroid with blood vessels, I told you. Then we are having the pigment cell layer, the retina with the rods and cones. Remember, 5th and 7th is here nuclear layer, 6th and 8th is plexiform layer. So this is outer nuclear and inner nuclear layer. This is outer plexiform and the inner plexiform layer. Ganglion cell layer and the optic nerve layer. Okay. Please remember these 10 layers, they are very important. So coming to the layers of the cornea, what we are seeing, stratified squamous corneal epithelium. Then here 2nd and 4th we are seeing anterior and the posterior limiting membranes. So anterior is the Bowman's membrane, posterior is the Decimet's membrane. Third layer is the substantia propria or the substance proper. And here we are seeing the posterior cuboidal epithelium. These are the 5 layers. So this is to show you rods and cones. So these are the rods and cones. Wherever we are seeing these colorful things, no, those are the cones. Where we can see black, those are the rods, okay, because rods are not sensitive to color vision as that of cones, which are sensitive to color vision. And pigment epithelium, okay, the retinal epithelium. We are seeing the bipolar cells and the ganglion cells also, and that light is entering, you can see that there. Let's see the difference between rods and cones. So let's see the important ones now. First important will be the sensitivity to light. Which is more sensitive? Rods, remember. Which has higher threshold? Cones. Cones have higher threshold. Which vision it's responsible for? Rods responsible for scotopic, that is night vision, and cones for photopic or day vision. Visual acuity. Cones responsible for visual acuity. Color vision. Again, cones are responsible for color vision. And photosensitive pigment, rhodopsin, when it comes to rods, remember R for rhodopsin, easier. And cones it is iodopsin. Okay, just remember only one, iodopsin, enough. So let us see with two important phenomena, light and dark adaptation time. So person, what does it mean? Light adaptation time. Person able to see when light is excess. So when there is an excess of light, this is 5 minutes. For example, when you are getting into a dark room and suddenly switching on the light. Okay, for example, let us say your hall is so dark. Let's say the hall is very dark now. It's night time, power cut. Let's say power cut happened. Okay, and suddenly power came. Okay, and before the power cut came, you're in the dark room. Suddenly when the power cut was not there, the light switched on suddenly. So it, you might have experienced that your eye would have blinked a little bit. Okay, that is what is light adaptation time. Okay, so it is 5 minutes. Important. Dark adaptation time in the dim light. Okay, so the best application we can see is especially the sea divers. In the night time they will be using red color goggles because red has more wavelength of light. Okay, and there will be temporary blindness due to decreased rhodopsin levels. We will see in the rhodopsin cycle regarding this, but understand that why there is a temporary blindness, because rhodopsin levels are low. This is 20 minutes, 4 times of it. So 5 fours are 20. You can remember like that. It is 4 times. And the another cause is the pupillary dilation. So 2 causes: decreased rhodopsin levels and pupillary dilation. So let's see this graph. This is called dark adaptation curve. So this is the cone adaptation you are seeing with the increased time. The intensity is coming down. It is not much, but in the rods it is very sharply observed. There is a sharp decrease in the intensity coming to the rods, but not very much in the cones. In the cones we can see it is becoming unaffected after that. After, let's say, maybe around 6 to 7 minutes, the threshold intensity after that till the end of this graph is constant. Okay, and this point is called the rod cone break, where there is a rod and cone adaptation, the sensitivity is impaired. That is a rod cone break. The point at which there is an adaptation of these two, that is a rod cone break or alpha point. You can also call it as alpha point. So let's see the chemistry of vision. In this, Wald's visual cycle is important. Okay, let us see. So rhodopsin, that is 11 cis retinal opsin. By the removal of this opsin, the opsin is regenerated once again. Okay, and by light we are getting all transretinal. It enters the retinal epithelium, forming the transretinal. All is removed. Then trans isomerizes to cis in the epithelium. Then again transretinal continued to the blood, from the blood into the liver. So in the liver, transretinal becomes into transretinol by alcohol dehydrogenase, and transretinol to cisretinol. So trans to cis, that's the change happened. Retinol is same by retinol isomerase. Then you are seeing the cisretinol on ADH, alcohol dehydrogenase. Here please don't think ADH is vasopressin. Many of the people will think that ADH means vasopressin, but no. Here ADH is alcohol dehydrogenase. NAD plus NADH, it becomes cis. Retinal bypasses the blood, entering the retinal epithelium. Then obviously it is obtained from isomerization, I told you in the starting. Okay, from transretinal, and then this cisretinal forms 11 cisretinal. So the word 11 is added, that's all. Then the regenerated opsin will be added to it to form 11 cisretinal opsin or rhodopsin. This is Wald's visual cycle. So let's see the visual cascade. What is happening? So most important from here is the transducin. So transducin is first activated, then it activates phosphodiesterase, then it converts 3-5- cyclic GMP to 5-GMP. This is the process. So let's see the physiology of image formation. What is happening? From the object we are getting some imaginary light rays that is hitting the surface of the lens. Once that happens, there is a refraction. Okay, because lens is a refractory surface. Okay, Mirror is a reflectory surface. This is the refractory surface. Okay, basic physics. Okay, and once it is refracted, the light rays will meet at the retina. Okay, and then anyway, so now the refractory power will be measured by diopters. Okay, and where diopter is nothing but 1 by f, focal length is measured in centimeter. Please remember that. Now let us see regarding to the color vision. What are the theories? Young's trichromatic theory, Herring's theory of opposite colors, and Hartrich polychromatic theory. Let's say Young's trichromatic theory first. So as we know, retina is having three types of cones: GRB, green, red and blue. Okay, they're all equally sensitive to white light. And then Herring's theory of opposite colors. Here retina is having three photochemical substances. Let us see. First one white black, then yellow blue and then red green. So here remember there are two substances. Second substance will be resynthesized. The first one will be catabolized. Okay. So here black is synthesized, white is broken down. Same you can do it for the yellow, blue and the red, green also. Now this is Hartrich polychromatic theory. There are totally 7 colors, okay, distributed into 3 receptors. So the first one we can remember it as GOB, green, orange and blue. Second, remember it as BY, blue and yellow. Third is GRB, green, red and blue. So just observe, green is common in the first and last. Blue is common in all of them. What is the extra we are adding? Orange in the first one, yellow in the second one, red in the third one. That's it. Now let's see the refractive errors. We have myopia, hypermetropia to show you in this diagram. So first, this is in a normal eye where all the rays are going to be converging into the retina. But hypermetropia, what is happening? It will go beyond the retina. Hyper is above or beyond. Okay. This is the correction by convex lens. Okay. So myopia, you are seeing the rays are meeting before the retina. Correction by concave lens. Once again, I am reminding you, hypermetropia, it is by convex lens. Myopia, it is by concave lens. Very, very important. Okay. So what will be the cause of this first myopia and hypermetropia is the antero-posterior diameter. It is increased in myopia, decreased in the hypermetropia. And anisometropia. Aniso means undifferent or they are disalike. Okay. So that there will be a difference in refractive power of both the eyes. So the correction will be either one of these, biconcave or biconvex. Astigmatism, the cornea is not proper shape, or you can say refractory power of lens is different in different mediums. With regular, irregular. Regular, it will be a single meridian. Irregular, it will be different points. Correction is the same, cylindrical lens, no change. And presbyopia, there is a loss of elasticity of the lens and the extraocular muscles are weakened. Correction once again, if I know for hypermetropia, for presbyopia, easy, by convex lens. Okay. So we are seeing the color blindness. There are the causes: trauma, chronic diseases, drugs, toxins, alcoholism and age. You can remember it as a simple way, I'll tell you, T square, toxins and trauma. T square, CD, A square. T square, CD, A square. You can remember like that. So trauma is the eye injury. Chronic diseases, you are seeing the neurodegenerative disorders like the Parkinson. And hematologic, that is our sickle cell anemia. Ophthalmologic, related to the eye, glaucoma. And also DM, diabetes mellitus. And drugs, antibiotics, any kind of antibiotic. Toxins, mostly carbon monoxide. Alcoholism, chronic, for a longer duration if anyone is alcoholic. And age, very common in old age. Okay. So let's see the classification. We have mono, di and trichromats. Trichromats. Okay. In monochromats, we have rod and cone. In dichromats, we have prot, dute and Tritanopia. Same with trichromat, easy. Just attach the word anomaly, easier. So prot anomaly, deuter anomaly, Tritanomaly. That's all. Let's see monochromatism, rod and cone. So what will be the difference? Scotoma is absent where? In cones. That's the difference you have to remember. Cones में scotoma absent. So seeing with the anomalies, prot, dute and trit. Remember, in prot, red color is defective. Okay. What colors will be working? Green and blue. In dute, green color is defective. So what colors will be working? Red and blue. In trite, blue color is defective. What are the colors will work? Red and green. That means to what colors he will be able to see? The red and green. So let's see the light reflex now. So light rays into the eye, first optic nerve, then chiasma, then the tract, then pretectal nucleus, then EWS, Edinger-Westphal, that is a third nerve, ciliary ganglion, from that a ciliary nerve, and it stimulates the constrictor pupillae. Okay, so this is about the accommodation reflex. Now we are going to see, that is the eye, optic nerve, chiasma, tract, lateral geniculate body, optic radiation, visual cortex area 17, then frontal eye field area 8, then Edinger-Westphal nucleus and the somatic nucleus. Somatic nucleus is for convergence of eyeball. EWS is for a constrictor pupillae and the ciliaris muscle. Okay. In the visual pathway, I'll tell you a diagram. This will sum up the entire accommodation reflex. You can understand better there. Now, what is happening during accommodation of the lens? So this is during accommodation and this is in a relaxed condition you are seeing. These are all same. The suspensory ligament, corneo-iris junction, ciliaris muscle. We are seeing the ciliary process, but this is important here. Now the visual pathway, it is a summary of the accommodation reflex. So what is happening? This is calcarine sulcus. From that the neurons are coming. That is the optic radiation. From the calcarine sulcus, optic radiation is coming, and then into the lateral geniculate body, they are relaying. Okay. Then they are this will form the temporal loop. This one, this red color, that is the Mayer's loop. Okay. And then we are finding this will enter the optic tract. Some of them will relay into the pretectal nucleus and then the Edinger-Westphal. So from the optic tract into the chiasma. Okay. Now from the chiasma into the this one. From the chiasma into the nerve and then into the eyeball, that is the retina, and the visual field will be created as you are seeing here. Okay, so we can divide the visual pathway and the lesions into anopia and hemianopia. Anopia can be either the left eye or the right eye. Hemianopia may be homonymous or heteronymous. Homonymous, same, left and right as that of anopia. Heteronymous, we can see binasal or bitemporal. Right, here we can see the site of lesions. Here is anopia. This site is anopia. Okay, and this site is the this is for the right. So A and B is anopia totally. This is bitemporal hemianopia. I told you in the pituitary tumors of the visual pathway. Okay, about this I told you. Here actually the heading will come, that is the lesions of the visual pathway. Okay, that's the heading here. And now optic chiasma. Here the lesions in the optic chiasma. Okay, and see, you are seeing here, these are the left and right. Left C and D here is for the optic chiasma. Okay, and here F and G is for homonymous hemianopia. So you are seeing the same thing in the diagram also. Okay, so let me explain. So total blindness of left eye, this one, this is for right eye. This is, what is the C? This is left nasal hemianopia. This is the left nasal hemianopia and this is the right. C plus D here is both sides of optic chiasma. Both sides of optic chiasma, that is the left and right. Binasal. And E. E is the bitemporal hemianopia you are seeing in the left and right both. And F, we are seeing the homonymous hemianopia. So this is with the right and this is with the left. So references from where I took the pictures. So that brings us to end of the video. So thank you so much. I'll see you in the next video.